Varicose veins can affect your life in numerous ways, but there is a way to treat them without pain or downtime, with lasers. Dr. Gamal Wazni from United Vein Centers has brought on patient after patient to share their stories with all of us. Today we just have you, but we're going to talk about just how much this can change people's lives. Great to have you back.
Thank you.
So let's talk about this. You've brought in many people through our doors here to talk about the success that they've had through the vein, not surgery, but the laser that you use to treat them. Are there still a lot of people out there that are living with this unnecessarily?
Yes, about 20% of the population suffers with vein disease. So there are many people out there with vein disease. We've been able to help many in Tampa Bay with this disease, but it's inherited and passed on from generation to generation. So yes, unfortunately, there are many that suffer.
And you mentioned being passed on from generation to generation. Have you done different people from the same family?
Yes. What will happen over the years is we've treated, say, a family member. They do very well, go back home, tell a sibling or maybe their parents, and of course, since it's inherited, they will come in and we'll end up treating them. As a matter of fact, we once had it where we treated the grandmother, the mother, and the daughter.
Oh, wow.
So 3 generations.
That's great.
Yes.
What can happen if people do not get help for this? And they just say, oh, well, I'm just going to live with it.
I believe we have a picture we can refer to. If you take a look, first of all, you will start out with possibly visible veins, such as bulging veins. And after so many years of blood sitting in your legs, you'll start to get the swelling, especially after a long day or sitting for a while. And after having swelling for a while, the blood will start to seep out of the veins, and then the iron in the blood will start to darken the skin. So you get this darkening in the area where you normally have a sock. And eventually, the skin becomes really weathered, it breaks down, and you get an ulcer. And that's the last stage of vein disease.
And I've seen people like this. You know, sometimes when you're out shopping and you look down, you say, oh my goodness, that's exactly what it is I'm looking at. So
yes,
they need help, and a lot of people think they can't afford it.
Correct. Patients think it's cosmetic, but it's not. It's a medical problem, and it's covered by insurance, just like vein stripping was covered by insurance. So yes, the laser treatments are covered by all insurance.
Now, just because you get it done once doesn't mean you might not have to get more in the future, right?
Correct. Like a cavity. If a healthy tooth develops a cavity, you have to fix it. It doesn't mean that another tooth may not develop a cavity. So in the vein, what happens with veins is another healthy vein may go bad, and we will have to fix it.
Some people might be wondering, how many darn veins do I have in my legs? If I start getting them zapped, am I going to have enough veins left?
Correct. You have many. These are only surface veins. They're not the deep veins or the main highways. They're just surface veins, and you have plenty of them. But when one out of many goes bad, it works against the system. So the healthy veins are carrying blood up, and that one diseased vein is holding blood. And because it's holding it, it gives you the swelling and the aching and the cramping. So by getting rid of it, 100% of the blood will go up.
And if you have to go back for a second or a third, is the insurance going to cover that as well?
Yes, they will. Just like they would cover if, say, you went back for another cavity in the future.